we will discuss the question number 206. It is very important for upcoming this AIIMS NORCET examinations. Here the most common cause of peptic ulcer disease is here the option A alcohol, option B smoking, option C Helicobacter pylori infections, option D spicy food. Here the peptic ulcer disease also would call it peptic ulcer or that is the stomach ulcers. Here the most important cause for the peptic ulcer is option C, that is Helicobacter pylori. What happens to Helicobacter pylori infection and inflammation? So it may lead to the sores on the that is mucous membrane of the stomach as well as the small intestine. Okay, so sore that appears on the stomach as well as small intestine, it is called as that is peptic ulcer. It is usually the most important cause is H. pylori infections. Here the second most important cause for this peptic ulcer disease, it is the use of the prolonged use of that is non-steroidal anti-inflammatory drugs. Here the two most important cause for this peptic ulcers. Here the alcohol and smoking, this act as a risk factor for developing there is peptic ulcer. Here the spicy food, we are having a misconception about the spicy food. The spicy food is not causes that is peptic ulcer disease, but the presence of the peptic ulcer. Okay, so the spicy food may worsen the symptoms. Okay, for that reason option C is the right answer. Here the peptic ulcer were classified into three types, that is gastric ulcers, the duodenal ulcer as well as esophageal ulcer. Yeah, one of the most important treatment for the peptic ulcer is that is triple therapy. It includes the proton pump inhibitors, clarithromycins as well as amoxicillin. Okay, so it is used for 10 to 14 days.